Good afternoon, brothers. Welcome to another program for the Holistic Wellness Month. Again, if you're not aware, the international program directors are um, doing a series of programs for the whole month of June around synergizing initiatives geared towards men's health awareness. I have the pleasure to be joined today by Dr. Rayford, who is my Sigma Health Coordinator, and we are going to talk about one of the 8 dimensions of Sigma Wellness, physical health and wellness. And that is about acknowledging the importance of physical activity, balanced diets, healthy living through a purposeful action as a man of Sigma. Dr. Rayford, when you think about physical health in terms of one of those 8 dimensions of Sigma Wellness, like we just talked about, what comes to mind off top of your head when we talk about that?
I think that, the definition we've used in healthcare of health being more than just not being sick. So the definition of health is not the opposite of being sick, but of being well. And so having well-being in the physical domain, the mental domain, social and spiritual domain. If we want to target it toward the physical health, that means being able to do the things that we want to do as a brotherhood, being able to serve, being physically able to serve, physically able to be there for our brothers, being physically able to pursue scholarship. We need the physical ability. And to have that, we need a body and we need our mind. And we need those working optimally to allow us to do those things, to live up to the motto, culture for service, service for humanity. We need to physically be able to do that.
That's a great point because, our Friday's theme is your health is your wealth Fridays, right? And we want to do this from a lunch and learn type of feel and keep it very loose. But we also want to make sure that we're targeted to talking about the needs of Black men and the minorities in this community, right? Because again, when we talk about your health is your wealth, it's important that we delve into exactly what you're talking about, especially because I think that in our community, it's not talked about enough. So when we talk about balance, right, between your health and your diet, right, can you just expound upon why it's key to why it's key for you to have a balanced diet when it comes to your health?
Yeah, that's kind of a perfect domain. Our bodies are not vehicles, but they are our instruments of action. And just like any vehicle, you need to have high quality fuel. And if you think of food as one part being the high quality fuel that we need to help our body function optimally, we know that we have a lot of options. We have a lot of options that range from what we call play food. Other people call that junk food. We understand that those foods, even if we enjoy it, that's not the optimal fuel for our body. And then there's the more staples. And when I'm talking about staples of the diet, I'm talking about that fresh stuff, fresh fruits, fresh vegetables, whole grains, foods that look like they look in nature. So minimally processed. And so we really do have to think about having the appropriate fuel. So selecting high quality fuels doesn't mean we need to avoid play food or junk food. Because some of that are enjoyable. We also have the ability as humans to enjoy our food. But the majority of the day, food is a fuel. And I think one thing that we can do is take the opportunity to reconnect to how food makes us feel. So what that means is being able to listen to our bodies that tells us that, oh, I'm full, or I'm a little bit hungry. Let me eat now before I'm super hungry and I'll eat anything. Or listen to your body tell you that I'm really not hungry. I'm actually thirsty. And so connecting to the body, I believe that God created us with what we needed and with the hunger signals. And how do you know how much to drink? Your body tells you when you're thirsty. You can use other signs to decide how much hydration you have. Nowadays we're distracted when it comes to eating. And so it's really important that we minimize those distractions and reconnect to the body, reconnect to the signals that our body's giving us. And our body's going to lead us in a good direction. I don't know, Brother Malwan, if you've ever had the itis. So that kind of feeling you've had something really, really rich in the middle of the day. And for me personally, I've noticed that it really depends on how rich my lunch is. That if my lunch is really rich in carbohydrates or really rich in fat, I'm going to get really, really sleepy about 2:00. And I'm miserable. I'm miserable at that time. And so, knowing how I feel, I'm more likely to pick a different kind of lunch because I don't want that feeling. I don't want to feel as down in the dumps.
So is that the concept around the 5 small meals as opposed to the 3 large meals? Is that where we're going, or is that kind of one of those diet myths that we hear about?
Yeah, I think it's a little bit of the 5 small meals, a little bit on the myth. It may be those people who, another thing is respecting your hunger. And so that means when you feel kind of a little bit hungry, before you get to like super, I'll eat a dinosaur hungry, you eat. Yeah. And so that 5 meals a day tends to capture a person before they get to that I'm ravenous kind of stage. Okay. And so, if we're listening to our bodies and we're responding when we're kind of not ravenously hungry, the choices that we make, I don't know if you've ever had a chance, and I've had it, where I just need to do one more thing. I need to see one more patient. I need to write one more note. I need to do one more thing on the computer. And before I know it, 3 hours has passed by.
Yeah.
And so at that point, I'm heading home. I walk in the house and I start eating the first thing I see. And what happens is, by the time my body reconnects and tells me, oh boy, I'm at that I don't feel so good full.
Yeah.
And then it was did I just eat all of that?
Yeah.
And so some of the smaller meals, some of that thought is that may stop people from having that I'm really ravenous, and now I'm going to let ravenous hunger drive me to eat. I was vegetarian for 2 years. And what I learned as a vegetarian is you really did have to prepare for that hunger cliff. And if you fell off the hunger cliff, you found yourself eating super junk foods. And I could never get it right when I travel, because right before I'm about to get on the plane, I'm really not that hungry.
Yeah.
Once I land and get to the hotel, I could eat cardboard. I'm so hungry. Yeah. And so what I normally do is eat what's in a hotel until takeout comes. And so it ends up being, I really didn't prepare for the hunger. And so when it comes to nutrition, we also have to prepare for the hunger, particularly if you're like vegetarian or vegan. And so the amount of proteins and things that you're consuming may be a little less and a lot less fatty. Yeah. And so fats and proteins can kind of give you this feeling of fullness a little longer than more carbohydrates. And so you really do have to prepare for it, because if you don't, you're going to find yourself like, when I was vegetarian early on, it was very thoughtful. It was planned. Later on, it was like crashing. It was always a crash. Yeah. It was always a crash. And so it was, what's vegetarian cake? What's vegetarian cookies, potato chips. And so it ended up being not the best eating pattern, even though it was vegetarian.
That's a good point that you talk about in terms of preparation. I've been pescatarian actually since February, but so I understand what you mean by the preparation piece of it. But I think that oftentimes people, just to put it bluntly, right, don't like vegetables and fruit, right? And if you talk about the organic fruits and vegetables, or just they cost a lot more, right? Yeah. And that preparation, when you're on the go, right, goes out the window, and then you find yourselves in the fast food line, right?
Mhm.
Because it's quick, it's easy, it's cheap, right? And I can
Yeah.
pretty much get about 3 fast food meals before I can get maybe a pound of fruits and vegetables, right?
Yeah.
If I or a couple pounds of fruits and vegetables, right? And then that requires me to store it properly. It's going to spoil if I don't eat it all, and then I actually got to take it with me to go. And if I forget that, I'm back in that fast food restaurant. It becomes a cyclical type of thing.
Yeah.
So, how do you think we can, as a people, right, especially if you talk about our underserved populations
Mhm.
and those communities where I understand that food deserts exist, but at the same time, we also live in an age where you can go and pay somebody through Grubhub or somebody else to go shopping for you to kind of reach those communities. But that's nevertheless doesn't take away that fresh fruits and vegetables aren't readily available in our underserved communities. So, how do we combat that to get people to understand and want to prepare their foods as opposed to taking the fast food alternative?
Yeah, I think that's a big challenge, and it's a challenge particularly where I am, where it's more rural. And I think I understand. I just tell people that you don't have to be perfect, and so everybody has an opportunity to be just a little better. And what
Mhm.
does that mean? I have to really acknowledge the privilege that I have, that I can buy fresh fruits and vegetables, and it doesn't hurt me that you know 25 to 30% of what we buy fresh ends up spoiling.
Mm.
And so I don't, personally, we haven't learned those food preservation kind of techniques, that we haven't used those optimally. I think there are ways that you can maintain not have so much spoilage.
Yeah.
And so there's an opportunity to kind of learn about spoilage. And when I'm talking to people in the community or even my patients, I tell people there's a food spectrum, that fresh fruits and vegetables are hands down the winner. And if there was a contest, but if that's not available, or that's somehow, if that's somehow, you know, too much, then frozen would be a close second.
Okay.
And that allows, the frozen is great because it's a whole lot more durable. And it allows you to store it a whole lot longer, and it still retains some of the nutritional value. So it's not a complete wash, and it's not as processed. And then, and then there's the trusted canned foods. The challenge with canned foods often comes in the preservation process. Usually there's a lot more salt
Mm.
in canned foods, a lot more preservatives in canned foods. And so if that's the option, there are ways that you can prepare canned foods to reduce the sodium content, to reduce the preservative content before you prepare it. And so there's an opportunity for everybody. And I'd like to talk about exploration. And so, telling people, let's not talk about what you can't eat. Let's talk about what you can add. Let's talk about what you can explore. How you can explore cooking things maybe a little different way.
Mm.
Down south, our southern cooking, man, we really beat up a lot of the fruits. We beat up a lot of the vegetables.
Yeah.
We cook the crunch out of it, and we often have a big piece of meat in it.
Yeah.
And so, learning different ways that if you're not ready to get the meat out of the collard greens and the green beans, to make it a leaner cut of meat. And
Yeah.
so we can just kind of move down the spectrum, meet people where they are. But I mean, you also have to respect that this food is doggone good.
Yeah.
This food is doggone good, which means that, there are some really innovative folks out there that's taken on making the Southern food have the qualities that we want, but also have some more healthful qualities, even like vegan. There's a lady in Atlanta with this really popular vegan restaurant that's kind of really killing it when it comes to preparing excellent vegan dishes. So it can be done.
Yeah.
And it's also can be pretty fun. So, for me, I like to take an exploration kind of look at it, try not to talk about deprivation. We don't do well with deprivation. It
Yeah.
doesn't make us love the foods that we need more of. and it seems to make us love the foods that we don't need as much of. And so, it's more about exploration, it's more about adding and saying, well, let me add one extra thing to this meal. Let me make 4 or 5 vegetables with this meal. Let me add a different fruit. Let me add a different, a different version of it. And I find that is people are more likely to accept it. I think we've kind of gotten really burned out with the diet stuff. It's about, you got to take away something that you kind of like so that your body can change in a way that you'd be satisfied with it. And I think that's really burned a lot of people out. And so a lot of people kind of, they may yo-yo, they may do it a little bit, then just kind of say, hey, since I can't do it, I'm going to go the other way. I'm going to eat every single thing that I know I shouldn't eat frequently because I can't go without it. And so I encourage people to take an exploration kind of mindset. And then I encourage people to just kind of pay attention to how this food makes you feel. Yeah. As I've gotten older, I'm more attuned to how food treats me. And I guess, for the younger brothers who don't know what I'm saying, just keep on living. Because there's this something called heartburn. Yeah. Depending on when you eat and what you eat, wake you up in the middle of the night, you feel like you're strangling. Yeah. And so, and that's probably a pretty common experience. And again, that's one of those scenarios where you can identify which foods do it. I know for me personally, if I'm eating 2 to 3 hours, within 2 to 3 hours of my bedtime, and it's a really rich meal, boy, that can be a lot of interrupted sleep. Yeah. And so, I'm more likely to kind of strategize when I eat, because not only is it fuel, but food starts treating you a certain kind of way as you hit a certain point. And there's actually no magic age for it. Acid reflux is pretty darn common. And so that's something to pay attention to around our eating, that, certain foods can make us feel bad. Yeah. So let me shift here. So when we talk about healthy living, healthy lifestyles, right? Yep. And we just talked about fruits, vegetables, getting your body or listening to your body about different things and how it feels and when determined to drink, eat, not being so full when you do so, right? Where does vitamins fit into this? What would you tell people in terms of your vitamins? You have there's so many. Every time I go down the vitamin aisle, I sit there for at least 20 to 30 minutes reading all the different brands, reading which one does one. Do I do a one a day, or do I just need vitamin A and K? Or what, do I just get these packets? And I find myself just getting the multi packets, right? Because it said that it helps with certain things that I feel like I should care about, like the heart, the brain, your muscles, your blood flow, your cholesterol, right? And I feel like they do a great job with the packaging on it, because it definitely, at least for me, pulls me to those multivitamin packets, right? Where most of the time I don't know, because I'm not a doctor, but I can't be the only one in this boat, right? So just explain, like, when does vitamins come in, and how do you see those fitting in your everyday lifestyle when we talk about healthy living? Yeah, so this can be controversial. This can be pretty controversial because I wouldn't call it controversial, but usually when I'm talking to patients and anybody, I'll tell them honestly, if you have access to fresh fruits and vegetables, you have all you need. So if you have access to fresh, colorful fruits and vegetables, you're going to find every vitamin you're looking for. There's some vitamins that you won't find so much in fruits and vegetables. Some of the vitamins come from meats. And so for a person who doesn't have any eating restrictions, so a person who maybe, a person who's vegan, or they may need, let's say pescatarian. Well, yeah, seafood has a lot of the vitamins that you need. So, you're getting some omega, some omega-3s, omega-6s. You're getting you're getting the some vitamin D in some of the fish. You're getting B6. You're getting B12 in some of the meats, some of the chicken type meats. And so you're getting those. And so for most people who don't have a restrictive eating pattern, if they had a colorful diet, so that means eating fruits and vegetables of every color of the rainbow, they're going to get more than just vitamin C, more than just vitamin K. They're going to get the other things, the antioxidants that come naturally in food. And I go back to it. I'm a firm believer that God gave us everything that we needed in terms of nutrition. And also there's a reality that vitamins are more of a Western concept. It's more of a West Europe, United States kind of thing. If you look at the rest of the world, particularly places where people live a long, long time, they have strong interpersonal relationships. They have a healthy variety of foods. They don't necessarily eat as much meat as we typically do in America. And they don't typically take vitamins. And so if we look at the places in the world where people are living the longest, vitamins aren't a big factor. And so I would tell them that, look, brother Johnson, if you got money to spend, no reason to spend anything more than that generic one-a-day vitamin will be, because they're all about the same combinations. They get to promise things on the labels. So that generic one-a-day will have more than what you need. And so you don't need to buy the $200 version, because you're not going to get $200 more effect. And so if you have money to spend, spend it conservatively. The other thing about our food in the United States, a lot of our food's fortified. For good or bad, a lot of our grains, particularly our processed grains, so rice, breads, even if they say they're wheat, they have some vitamins in it, folic acid. We fortify our cereals. We fortify our milk with vitamin D. The only vitamins that I would tell brothers to just make sure we know what our level is, because it may help promote good health, is vitamin D. And so brothers, knowing what your vitamin D level is, there are some suggestions that people with darker skin tones have lower vitamin D levels. People who are heavier than normal can have lower vitamin D levels. Vitamin D is important for calcium metabolism and bone health in particular. May be helpful in the immune system. And so knowing what your vitamin D is, an important source of vitamin D is sunlight. And so spending some time in the sun, another thing God gave us the ability to take sunlight and allow sunlight to convert a vitamin D precursor in our skin to vitamin D that we can use. It's one of the vitamins that, if you live in a northern climate and it's pretty cold and cloudy, your sun exposure may not be as much as if it was a lot warmer. And so knowing what your vitamin D is, you may need to intentionally pick vitamin D rich foods. And those foods are usually fortified. So it ends up being a lot of dairy. But vitamins are okay. Vitamins don't replace a healthy diet. And so you can't take your one a day and then live on play food or junk food. Right. You couldn't do it. Yeah, you couldn't have, you couldn't do your vitamins and, subside on the diet of beer and cigarettes.
Yeah. Yeah. So shifting gears to, we talked about the food and, but the also part is how, can we just, for a brief moment while we got a little bit of time during this lunch break, start talking about just our levels, right? I am now kind of a big proponent of knowing what my A1C is, knowing what cholesterol, and even though I don't understand it because it's like every time you get a blood work, you see like 5 different numbers of your cholesterol. and then it kind of varies in this
Yeah.
range,
Yeah.
and unless you got a doctor to really explain it, they really can kind of like, what is all these numbers, LLD, HLD, all these kind of things, right? So can you just kind of talk about, how now we're talking, we just got finished talking about the food aspect of it, but how does that relate to what you see and what you get from your normal physicals, and when you get your blood work back and you see all these numbers on a piece of paper, like just kind of just not going too far over our head, but just in general, how does that translate to the levels that we may see coming back from the
Yeah. Yeah. It's a perfect transition. So I tell people that there are some numbers that you need to know about yourself. Some of those numbers are measurements. Some of those numbers are measurements that don't involve a blood draw. And then some of those numbers involve a blood draw. Number one important number, Brother Johnson, is your blood pressure. Everybody needs to know what that number is. And more importantly, they need to know whether that number is high, normal, or in the middle.
Mm.
Untreated blood pressure is one of the biggest risk factors for stroke. Where I am, stroke and heart attack, if you add them together, they're killing more and more people. As men, particularly African American men, at age 45, stroke and heart attack becomes the number one killer.
Mm.
And so we're seeing strokes and heart attacks in much younger people, and that's an intersection of family history, bad social environment, and other factors. But a really important number that we should all know is our blood pressure. And then we need to be honest about our numbers. And what we know about blood pressure is that the numbers matter, not the explanation. I have people that get their blood pressure checked and they always have an explanation. So if you find yourself trying to explain what the number is, there's a strong likelihood that you have high blood pressure, and we need to start doing something about it. So before that person makes that 100th excuse of saying my blood pressure is always up in the doctor's office, we know that those patients still suffer from a higher amount of strokes and heart attack compared to those people whose blood pressures are normal in our office. So the blood pressure is an important number for you to know.
So what's the numbers? What's the ranges that you're talking about when you say high?
Right. So we know that if you are above 140, so if the number is 140 on the top, so there's two numbers. There's a top number, bottom number. We may call it systolic or diastolic. If the top number is 140 and the bottom number is 90, then that's the definition of high blood pressure. If you have that on multiple settings, you have high blood pressure. The optimal blood pressure. So if you ask me, Brother Johnson, what is the ideal blood pressure? It looks like 120 over 70 is the ideal blood pressure. That is the blood pressure at which it seems that every time you go up 5 to 10 points, you get a doubling of heart disease risk. You get a doubling of stroke risk. And so we start real low. And so those people whose blood pressure top number is 130, so 130 to 139, those people are actually at risk. And those are the people where you can take this opportunity to improve your nutrition. Sodium is a big factor when it comes to blood pressure. Fruits and vegetables. And when I'm talking about sodium, reducing your sodium, increasing your fruits and vegetables, exercise, a little bit of weight loss. Those things can help a person at that point not get to the point where they need medications. We typically employ medications when that number is 140 over 90. The hard thing about blood pressure, Brother Johnson, is you don't feel bad early on. And most people don't feel bad, but we know that if we let those people go by untreated for 10 to 15 years, the first time they feel bad for their blood pressure is when they can't move their left side, when they can no longer talk, when they can no longer walk, or when they're having such bad chest pain that they're breaking out in sweats, and that we're having to rush them to the cardiac cath lab as soon as they get through the doors of the hospital. And so we know that the silent years of the high blood pressure is doing the damage. We know that high blood pressure is a common cause of kidney disease. And so that if we let blood pressure go uncontrolled, people get kidney damage. And if you go on dialysis, dialysis is a really hard thing for the body, that people who go on dialysis have a really, really high risk of dying in the next 5 years. And so it's just that serious. It's asymptomatic, and then boom, something bad happens that most times we can't get you back to your normal self. So blood pressure is important, knowing what your numbers are. If you have to explain a reason that your numbers are elevated, I went to urgent care because my sinuses were acting up, you have high blood pressure. And it's really important to get it addressed. Another important number is, you mentioned the A1C. That's the measure of your blood sugar that tests you for diabetes. That's another disease that when you manage it early on, you save people from a lot of complications that include amputations, heart attacks, strokes, having nerve damage, and being on dialysis, and even going blind. And so the A1C is one measure. That's a measure of your blood sugar for about 3 years. Normal is less than 5.6 or less. Having diabetes is 6.5 or more. There's an in-between group, and that group is actually large. That group has an A1C between those values. We know that if you take that group, like we do with blood pressure, if you take that group and you add interventions, including their nutrition, exercise, a little bit of weight loss, those people can prevent developing type 2 diabetes, or they can push off the development of type 2 diabetes by many years. And that lifestyle, doing those lifestyle changes for that at-risk group is more beneficial than medications. And so it's really important, you're right, Brother Johnson, to know that number, your A1C. Now, some people may not get an A1C. You can get a fasting blood sugar. It has a different number range. I won't give it to you, but it has a different number range, and it can identify those people who are normal, those people who have diabetes, and then that middle group. So it's estimated that middle group, and we call this pre-diabetes, it's estimated that middle group represents 1 out of every 3 adults over 18.
Oh, wow.
And if you are 60 and older and don't have diagnosis of diabetes, it may be as frequent as 1 in every 2. So half of adults 60 and older fall into that pre-diabetes range. And so it's a really important thing to kind of know where you stand, because there's so much we can do before you get that label of diabetes. Once you get that label of diabetes, so brothers, I'm talking as a physician, but brothers, we're young, we're starting our careers. Sometimes we're more advanced in our careers. The older brothers will probably tell you. But no, as you're young and you're thinking about financial plans and stuff like that, man, having a diagnosis of type 2 diabetes in your 30s, you're going to pay a lot of money for life insurance. You're going to pay a lot of, and that's a practical kind of thing. You're going to be seen as super high risk. And so there are some incentives in terms of like our financial health to improve our physical health. And that's one of those things that it's really important to have that relationship with a physician or a nurse practitioner or physician assistant, so that you can get those regular things. And then the last number that I think everybody should know, and then there's some numbers that you should know if you're a certain age. So the last number that everybody should know is actually a group of numbers. Brother Johnson, you talk about your cholesterol panel, your lipid panel.
Yeah.
And so there's actually 4 components of it. There's a total cholesterol component. There's a triglyceride component. There's the HDL, which is the good cholesterol. So the higher you have on the good cholesterol number, the better you are. And then there's the LDL, which is the bad cholesterol. The higher you have of that, the worse you are. And so we normally check that lipid panel. And so essentially, everybody should at least have a lipid panel. If your weight is higher than normal, you should get a lipid panel, even in your teens, in your teenage years, getting your lipid panel checked. If you're normal weight, getting your lipid panel checked at least starting in your 30s.
Mm.
And then the last number that we should know as men, particularly Black men, we need to know what our PSA is. PSA, that's the blood test that we use to screen for prostate cancer.
Mm-hmm.
We need to know our PSA. If you don't have a family history of prostate cancer and you don't have any urinary symptoms or things like that at age 45, and that's a number you should know every year. Many times, this is a number that we may have to advocate for ourselves because the screening recommendations have changed. And there was a point where we in the medical community were actually discouraged from routinely checking the PSAs. And so the pendulum has kind of swung from that to back toward identifying which men are at higher risk. And so if you're of African descent, you're at high risk. If you're a racial ethnic minority, you're at high risk for prostate cancer. What raises your risk a lot is if you have a first degree male. So if your father, brothers, you have uncles, grandparents, if they have a history of prostate cancer, then you may need to be screened early. So, if you have a family member that was diagnosed at 50, you may need to start getting screened at 40. This is not something that we clinicians are going to bring up. This is something that we need to know to ask about it. As we're going to that visit, as we're getting to 40, and it's a simple question. Hey, doc, is it time? Or, hey, is it time for my PSA screening?
Yeah.
And sometimes you may have to change your clinician that if they're not on board with helping you get that information because you have an understanding that you're in a high risk group, you may need to find another clinician that's going to screen you appropriately. But the PSA, that's a number that, that's kind of a number. September is Prostate Cancer Awareness Month. That's a month. We've had sessions where earlier sessions where brothers talked about being diagnosed earlier than they would have routinely been screened. And that was because they had comprehensive physicals.
Right.
And so that's another number that's important to know, particularly if you're 40 and older.
That is awesome. I think all those four numbers are great. And I think that my follow-up is, I know you mentioned it from a prostate perspective, cholesterol, I think you kind of hit on it, but from the blood pressure and your A1C, is that like a yearly physical thing where you're getting blood work, or is that something where, like, what's the frequency that you should be checking your number, especially with blood pressure? I mean, I know you can get at home like devices that you can check your blood pressure, but is that something that you should be doing on a daily basis? Like, because sometimes you can get, kind of over, I don't know what the right word is, but you just checking it, keep checking it
too much.
You're checking it too much, and then you kind of get yourself all in like a panic mode because you hear that and you say, now I may be driving my own blood pressure up just by worrying about maybe that one number, right? So is there a frequency that you should be checking or going to see your doctor to get that routine checkup? Is that your yearly physical, or is it often more often than that?
Yeah, when it comes to blood pressure, every clinical visit, your blood pressure is going to be assessed.
Yeah.
It's that important. So every clinical visit, so every encounter in the medical community should involve a blood pressure, even if it's for my ear hurts.
Yeah.
It's just a really good opportunity to assess this really important problem. Now, when we talk about monitoring at home, you're right, Brother Johnson, that there's some people that can get worked up around their blood pressure. And there's some people that we say, no, you don't need to check that many times a day. Typically, I would tell a person, if they're going to check their blood pressure, to do it at least 3 to 5 times a week. And we really talk about the optimal way to check your own blood pressure. So at home, the way that you do it is with an automatic machine. So you want to make sure that you got a reputable machine. We got to make sure that the cuff that fits on your arm is appropriate for the size of your arm. So the brothers with the big muscles, they're going to need a bigger blood pressure cuff. Brothers with smaller arms are going to need a smaller blood pressure cuff, but make sure it fits right. And then you want to make sure that you're in the right position, that your arms supported, your back supported, your feet's flat on the ground. And then there are better times of day to check the blood pressure. So first thing in the morning after you've kind of emptied out, before you've eaten, definitely before you've taken caffeine, definitely before, you've smoked. That's the best time to get a blood pressure. 3 to 5 times a week for those who are, want to kind of know what it is. Say your doctor say, hey, your blood pressure is on the borderline. Hey, I want you to start checking at home and just bring me back 2 weeks worth of readings. And then for those people who are on multiple blood pressure medicines, some people are on 2 times a day blood pressure medicines. They may need to check a morning blood pressure before meds, and maybe a evening blood pressure before meds. And so, multiple times, any more than 2 times a day, it's probably going to get you, because we also know that blood pressure is dynamic. If you're restful and completely at peace compared to if you're anxious or scared or nervous or mad or in pain, we know that those numbers are going to be affected by the other conditions. And so measuring it too frequently, you may end up capturing something else. You may be capturing anxiety.
And so let me ask you this question. Is there a different, does the arm matter, right? Is it a left arm, right arm thing? Or, I've found that when I've checked my blood pressure, one arm is always different than the other, right?
Yeah.
And I never understood why that is if they're all feeding the same system. But is there any, like what happens if like your one arm is lower than the other? Do you take that that arm because it's lower, or do you average the 2 out? Like, you know what I mean?
Yeah. But the one thing I tell people that we're not as symmetric as we think we are. And so we're not as symmetric as we think we are. So what we tell people is that as long as it's not astronomically different, so if there's like a 20 to 30 point difference in the arms, we need to evaluate people to see if they have vascular disease. Some people have underdeveloped arteries. Some people have blockages that cause one arm to be significantly more elevated than the others. But if it's 5 to 10 point difference, we tell you to use the highest arm. Don't use the lowest arm.
All right. Okay. All right. Well, hey, it's definitely we're coming into that top of the 45 minutes. We want to keep this as a lunch and learn. So definitely want to appreciate and shout you out for jumping on during your lunch hour in between your patients and making some time for our Your Health is Your Wealth Friday. Definitely appreciate that. Is there any parting words that you want to give the good brothers and the people viewing this presentation?
Yeah. So, I want to remind the brothers that, our ability to, live up to our motto, our ability to serve is affected by our own health. We all know brothers who aren't able to serve like they want to serve because their health is not good. And so my encouragement is brothers to be good shepherds of their body, to make sure that we're thinking about the appropriate fuel for our body. We're moving our bodies. We're learning about what our bodies are at risk for, that we're taking it serious. We're getting screening, that we have relationships with healthcare providers who are going to screen us and is going to help us identify problems early, prevent problems, and also want to put a plug in for the rest of the week. Well-being is affected by more than just what goes on in our bodies. And so, there's still a role for advocacy. There's still a role for the rest of social action, for health, because there's a strong environmental component. to why certain groups, particularly African American men, have some of the worst health outcomes. And a lot of that has to do with adversity in our environments. And so definitely want to put a plug in for the rest of social action because it really is a health measure too.
Absolutely. I appreciate that. And again, I definitely want to shout you out and appreciate you for joining our Your Health is Your Wealth with Fridays. You know, we're doing this lunch and learn every Friday throughout the month of June. I know you're going to be in my role, interviewing and sharing those thoughts with other doctors in our committee. And I definitely appreciate the plug because we do have Mental Health Mondays coming up. You know, your sweat, getting ready for that sweat on Sundays with our Fitness Wellness Committee. And so again, definitely appreciate everybody for tuning in. Stay tuned for more sessions for this coming Friday as well, where we'll have another doctor on to share what their thoughts are around that dimension of physical health. And so I say go mob to you, Brother Rayford, and enjoy the rest of y'all Friday and your weekend to the rest of the brothers that tuned in. Thank you.